Few women come to our OPD for termination of a pregnancy which is unwanted. So first, why does unwanted pregnancy happen? It could be because maybe newly married people who want some time and who have got pregnant very early during their married life. The second reason could be they would have delivered right now and maybe they would have got pregnant again in 6-7 months time. They might want a termination. And the third reason could be they could have 2 to 3 kids and they could have got pregnant again and they might not want the child right now, or they might want only 3 children, so they might want termination of pregnancy. So the first thing what the parents, the couple ask us is, in case if we have a termination right now, will it affect our future pregnancies? So a termination done right now for this pregnancy might not affect your future pregnancy, or it might affect. It depends on the weeks of pregnancy, whether it is 5 weeks, 8 weeks, or more than 8 to 9 weeks. So if it's a very early pregnancy, we can always terminate with medications. But if it crosses 8 to 9 weeks, then definitely we'll have to do a procedure called curettage, that is dilatation and curettage of the uterus, which is called DNC. So in case if we need to do a DNC, we might be scraping the endometrial layer, that is the innermost layer of the uterus. It might not help you get pregnant in the future, but that is very, very rare. And also the medications, if we take the medications, there could be some remnants which also might lead to DNC. So mostly there won't be any issues for future pregnancies, but definitely preventing a pregnancy is much better than getting a termination of pregnancy. It can prevent many things like infection, post miscarriages. It can also prevent irregular periods. It can prevent adenomyosis of the uterus. So preventing a pregnancy is much, much better than getting a pregnancy terminated. In case if you have unintended or an unwanted pregnancy, that's okay, but visit a doctor as soon as possible. Don't take pills from over the counter from a medical store, which can cause even more harm to you and to the pregnancy. First, confirm your pregnancy, whether it is intrauterine or extrauterine, like an ectopic pregnancy. That is very important. And then go for termination. Always be medically guided. Don't do it by yourself, which can lead to other problems later for future pregnancies.